It is by no means a done deal, but today we finally learned how Senate Republicans plan to do away with the Affordable Care Act, also known as Obamacare. The 142-page proposal repeals the mandate for individuals to buy health care. It also cuts Medicaid funding, but at a slower rate than the House bill, eliminates nearly all the taxes under Obamacare, and would defund Planned Parenthood for 1 year. The draft bill also gives states the flexibility to decide which Obamacare benefits to cover. As you would expect, today's big reveal wasn't without some partisan finger-pointing.
It's still, as the president called the House bill, mean. After celebrating its passage, he then changed to saying it's mean. He said that he hopes the Senate bill will have heart. So sad, Mr. President. Heartless. Mean and heartless.
We could have a better bill, but given the refusal of our Democratic colleagues to participate in the process, this is the only way we can come to the rescue of the people who are being hurt by the meltdown of Obamacare today.
So with a self-imposed deadline of July 4th to reach a deal, the question now is, are the votes there in the Senate? And if so, what does it mean for Massachusetts health care? Joining me are Josh Archambault, a senior healthcare policy fellow at the Pioneer Institute, Jonathan Gruber, a professor at MIT and an architect of both Obamacare and Romney Care here in Massachusetts, and Renee Landers, law professor at Suffolk University. Thank you all for being here.
Thank you.
Jonathan, let me start with you. As someone who helped create the system that the Republicans are seeking to undo, would you rather see the Senate's tentative version become law or the House's?
It's a great question. I'd like to see neither, of course, is the first answer. I
thought you might say that.
It's interesting to compare them because in some sense, at least the House plan is a bit the virtue of us trying to do something different. I mean, the Senate plan literally just takes Obamacare and makes it half as big. It's what Krugman called Obamacare version 0.5. There's literally nothing accomplished by the Senate plan. The House plan, you might say, well, if you prefer flat tax credits, income-based tax credit, the House has that. The Senate doesn't. It just literally makes it weaker, makes it worse, spends less. But the feature they share is, look, if you're a libertarian and you believe in a smaller government and you think we should scale back the government's commitment to health care in order to shrink the size of the government, that's a legitimate point to take. But this law, all it does is finance a tax cut for the rich. It doesn't reduce the deficit. So I don't understand the point of it.
Josh Archambault, I think of you and John as having diametrically opposed viewpoints on health care. What do you like about the Senate's approach, and where do you think it might fall short?
Sure. So I think the Senate approach is a good step, but let's keep some context here. For those on the left and supporters of the ACA, we're going to say they hated this no matter what. And the bill actually doesn't go as far, as Jonathan kind of just acknowledged. It leaves about 90% of Obamacare in place, but it does try to do some important things, which is reform the Medicaid program. And there's a number of issues with that, one being, and driven by the ACA, is it prioritizes able-bodied adults over disabled and pregnant women based on the way that it funds it.
You're saying that happens right now?
Correct. And so this bill does try to address those perverse incentives. There's a lot of low-hanging fruits for states to reform their Medicaid programs, and this starts to get there.
We don't have time, unfortunately, to get too down in the weeds, but how does the current iteration of Medicare prioritize the able-bodied and healthy?
So this is an important. So for Medicaid, the ACA or Obamacare gave more money to states for those populations versus the traditional population. So when a state has to balance its budget, which it does, unlike the federal government every year, you can imagine where they go first to cut it. The irony of all of this is that Mr. Gruber has okay with cutting $700 billion from Medicare as part of Obamacare, but has objected, like many others, to the changing of the structure of Medicaid.
I see John shaking his head, and I want to give him a chance to respond. But first, I want to give you a chance to get in here, Renee Landers. The Senate bill, as we just began talking about, it phases out money for the Obamacare expansion of Medicaid. As I understand it, it is going to change the way federal money for Medicaid is dispersed to the states, resulting in lowered payments to the states. I want to read a tweet that President Trump sent in 2015, back when he was candidate Trump. Back then, the president said, "The Republicans who want to cut Social Security and Medicaid are wrong. A robust economy will make America great again." Why this about-face when it comes to Medicaid on the part of the president, who today said he thinks the Senate bill is going to be a very good bill?
Because I think partly as the president himself has said, that, healthcare is, who knew it was so complicated? Right. And I think he still does not understand all the complications, with all due respect to the president. Second, I think that one of the reasons is that Medicaid has always been the poor sister of the Medicare program. There is a history, a long history since colonial colonial times in America of people wanting to help only the deserving poor and not people who they think are unworthy of the community's support. And the Medicaid population has historically fallen into that, in and among that group of people.
The undeserving.
The undeserving. If you are poor, then somehow you must deserve that fate. And we all know that life circumstances can, derail the best laid plans that people have. So that's not necessarily true. And the other fact is that I think the incentive for the so-called able-bodied adult population that the federal government is, providing incentives and extra money to the states, it was to encourage the states to take on that population, because the reason they weren't historically part of Medicaid is that they were viewed as the least sympathetic. They weren't widows, orphans, infants, children, mothers.
I wanted to let you respond to Josh, but I'm wondering if Renee might have just given the response that you were going to give to Josh.
Well, no, I think Josh actually raised a really important point, which is healthcare is complicated, as Renee said, and it's about trade-offs. The idea of the Affordable Care Act was to balance those trade-offs. The Affordable Care Act did cut Medicare in order to provide health insurance for needy low-income populations. This law is not about trade-offs. This law keeps the Medicare cuts in place. So the Medicare cuts that help finance the Affordable Care Act are in place. They're not going away. It's just saying, on top of that, we are going to not balance. We're going to literally just take away health care from the poorest citizens. We are also going to take people who are low income, who currently pay a fixed percentage of their income. We're going to make them pay a higher percentage of your income to get worse insurance. So this law means you'll pay more of your income to get a very high deductible plan. And the return is not some greater good. It's just tax cuts for the rich.
Josh Archambault, Governor Charlie Baker recently wrote a letter with a handful of other governors, Republican and Democratic, to the Senate, in which they said that the Senate bill should do, from their point of view, a few different things. They wanted it to improve affordability, restore stability to insurance markets, provide state flexibility and encourage innovation, and improve the regulatory environment. 4 different priorities there. Do you think the Senate bill makes progress on any of those?
It starts to. I do think there's a lot of work, and just to be very clear for viewers, this is going to change in the next week. There will be a robust amendment process going forward. So I do think you're going to see additional amendments put forward to give additional flexibility on Medicaid for states. There's going to be some insurance regulation changes as well. Massachusetts is in a unique position. We have to remember, under the status quo, there are markets around this country where there will be 0 insurers next year. That's not a choice. And so we do have to take action. That's the result of the ACA, where we have led to. And without taking action, I think that is responsible and what Charlie Baker is trying to get at.
Let me ask all of you, if 3 Senate Republicans do not support this bill, it's going to be dead. As Josh points out, there's going to be an extensive debate and amendment process. But we've already got Rand Paul, Ted Cruz, and 2 other conservative Republicans saying actually something that I think you two might agree on, that this is basically Obamacare light, although they have a different sense of what that term means than you do, obviously. Susan Collins, the moderate Republican senator from Maine, has not said whether she'll support it or not, but put out a statement today expressing concern, which I think we have here. There we go. Senator Collins will carefully review the text of the Senate health care bill this week and into the weekend. She has a number of concerns and will be particularly interested in examining the forthcoming CBO, Congressional Budget Office, analysis on the impact on insurance coverage, the effect on insurance premiums, and the changes in the Medicaid program. Very, very long way of me asking, politically, is this thing going to get the 50 votes with Mike Pence breaking a hypothetical tie that it needs to pass?
I think it remains to be seen. I think it's uncertain because I think they have problems on both the left and the right. And the one thing that wasn't on the list of the quote from Susan Collins were the cuts for Planned Parenthood coverage and maternity care, those sorts of things, which I think some of the moderate Republican women in the Senate are very concerned about. And, I don't understand how you can have, you can value life and not cover maternity care. I don't understand how that computes.
What do you guys think about the political calculus?
I mean, I think basically, I'm not sure what the term moderate Republican means anymore. I just would challenge Susan Collins to sit down and go through every resident of the state of Maine and ask who wins and who loses. I think she would find that basically only people who win are people making more than $250,000 a year. If she wants to admit she's happy to place her vote on that group, then let her admit it. But I don't see how any accounting of the vast majority of citizens in Maine could think this is a good idea for that state.
Josh, we'll get 50.
It's a political exercise at this point, and they will get 51, I think, because they're going to try to get to conference and switch the bill there.
This is a huge question to bring up with, I think, about 1 minute left in our conversation. But I think a lot of Massachusetts residents feel like we are in some way protected from whatever the negative effects might be of any Republican-driven reform because Romney Care is on the books. But as I understand it, Romney Care was retrofitted to be made congruent with Obamacare after the ACA passed. Governor Baker said we could lose, I think, $1 billion a year in the early 2020s, going up to around $2 billion. How much protection does Romney Care give us for intended or unintended negative consequences?
It does largely on the insurance side. The Medicaid area is really where there's the biggest changes. But on the tax side, there's big implications here for the Massachusetts economy. The medical device tax, the insurer tax, these are big issues here. It doesn't get rid of the Cadillac tax, which is on premium health insurance in the state. That is going to impact union insurance going forward and other generous employer-based insurance. So there are big implications, both pros and cons here for the state.
Well, Governor Baker has said that if the cuts that he will put state funds in to replace dollar for dollar the Planned Parenthood cuts, and so that's one piece of the insurance policy here, I think.
Actually, let me give you the last word since you helped write it.
So the bottom line is, what Massachusetts has done is said we will protect our lowest income citizens above and beyond what the Affordable Care Act did. To do that now, with Republicans cutting the tax rates in the Affordable Care Act, will cost us hundreds of millions of dollars more. So Governor Baker's going to have a difficult decision to make. Does he want to let Massachusetts look like the rest of the country, where lower-income people pay 10, 15, 20% of their income for health insurance? Or is he going to preserve what we have now, where people pay maybe 5% of their income for health insurance? That's going to be a hard decision.
All right. Josh Archambault, John Gruber, Renee Landers, thank you all for talking about this.
You bet.